This is showing acupuncture over the hand. And hands are, take a lot of beating. We use our hands all day, every day. So you can use acupuncture to definitely relieve arthritis or pain in the hands, the thumbs. It's a really often used way to use acupuncture. So again, we're making sure that our area is clean. We've swabbed it with alcohol. And I'll demonstrate a couple of different techniques here. So first, the hands are a really nice way to show how we can avoid veins or arteries on the hand, because the backs of the hands have these really visible veins. So again, you take your non-needling hand and you just gently push the vein out of the way. And this gives you a clear target. You can insert the needle. And once the needle is in the skin, then you just release and that vein will just kind of go back into place. So that's one way to needle the hands, just being cautious. We don't want to needle into the veins of the back of the hand. You can also work with the spaces here in between the fingers. And this is a really nice way to help alleviate the symptoms of arthritis in the fingers and the big joints of the fingers. Is you take your needle and you're going to work on a very transverse insertion, and you're just going to follow along here, along the metacarpal. So you just go in between the fingers, press the needle in, and just follow straight down. And they should slip right in between the metacarpal. And you can do this between each of the metacarpals. And this is a really nice treatment for arthritis in the fingers. Here I'll demonstrate how to needle really along these joint spaces. And you can use the same techniques as the hands as in the feet, and often the same problems show up in the feet as well. So let's say you have a client who's having some pain here in the joint. You want to take a really small needle. This is about 1/2 inch needle. And then I really like to use guide tubes on the hands and the feet, because you just have a little bit more control of where you're getting the angle of the needle. So let's say, for example, that this client is having some joint pain or swelling here in this proximal interphalangeal joint. Then you're just going to find right into the joint space and just barely tap the needle. I'm using about a 20-degree angle here, and this would just go right into that joint space there. So you might need to move the needle around just a little bit to make sure the needle is finally situated exactly where you want, which is directly here in the joint space. Thumb pain is a really big one that you can use acupuncture to relieve. And remember when we talked about the channel, the course of the meridian, we have the lung channel, which goes right along here, along the thenar portion of the thumb. So we can do a couple of different things with the thumb. We can take a needle and go right into the thenar of the thumb. All right, so you take your needle and you just go right in between the bone and the thenar muscle. Press the needle in. Once it's in, you can drop that needle straight down here. So it's resting in the thenar muscle of the thumb. Another thing that you can do, and this is nice to demonstrate appropriate size needles. So let's say that my client here is complaining of pain in their thumb joint or arthritis, swelling in the thumb joint. If I select a 1-inch needle and I try to put this into the joint, you can see what happens. I try to put it in, and then we get these like floppy needles, and the needle's just kind of hanging out here. And that's A, not very comfortable for the client, and B, I'm not going to be able to quite get that needle into the joint space where it needs to be. So this is a nice example of showing how using a smaller, say a 1/2-inch needle, this is what's appropriate to that space, because the smaller needle will be able to get into and rest in the joint space. And again, when you're using the guide tube, you just press the tube into the skin and very gently press the needle until it penetrates and makes contact through the skin. No tapping, no hammering. All of that's going to be very uncomfortable and pretty surprising for your client. So you just move nice and smoothly. And then now I'm able to get the majority of this 1/2-inch needle into the joint space. I know it's where I want it to be, because when I kind of pull on it, I get that fish hook sensation. And I know that I've gotten that chi sensation. I'm really going to be able to relieve quite a bit of pain and inflammation here in the joint space. When it comes to selecting acupuncture points, of course, you have the whole body to work with, right? But you can select between either local points, like what I'm doing here on the hand, or you can select points that are a little bit more distal. So if you're going to select a local point, and that refers to a local point over the local area or the local condition, like exactly what I did here. I selected points exactly where I thought pain or arthritis might be. And these local points are really good for any condition to do with the limb, like any arms, legs, feet, things like that, elbows, shoulders. You really want to go directly into the area with the acupuncture needle. Anything like superficial acute conditions as well. So toothache, earache, you can also use local points for those types of conditions. When you're choosing a distal area of the body to work with, then that's where you want to work with things that are far away from the condition of the original chief complaint. And those points are usually located from the elbow to the tips of the fingers and from the knee to the tips of the toes. And those are really nice for working with conditions of the internal organs. So, for example, we can work with certain areas of the hand along the triple burner channel, because remember the triple burner had a lot to do with the ears. So if we wanted to work with something like ringing in the ears or ear pain, we could work anywhere here along the triple burner meridian. We could also work along the lung channel anywhere on the hand, like if we were working with coughing, shortness of breath, sore throat, asthma, we definitely, select these distal points along the lung channel.
If you liked this video and you want to see more, make sure to subscribe below and don't forget to hit the notification button.